Hi, everyone. My name is Nadia, and welcome to episode 9 of our series, Doctors' Aspects on Healthcare. Today, we're talking to a very special guest, Dr. Mohamed. Thank you for taking the time out of your busy schedule to be here today. And so let's get started. How are you doing? How are you
I'm
doing?
doing I'm doing well. I'm happy to be here. We're in a particular time and moment of history. I think just kind of the pandemic is still present, but we're still in that little climax point where we can kind of pivot it and put it in the right direction towards putting it hopefully down.
hmm Definitely. Would you like to tell our viewers just a little bit about yourself?
Yeah, so I am actually a first year general surgery resident. I am currently in practice at the Detroit Medical Center in Detroit, Michigan. Um, in terms of my background, I'm Lebanese American. I was born and raised in the United States. My father was born and raised in Lebanon, and he migrated when he was 16 years old. My dad is a pharmacist by trade, and my mom is a pediatrician by trade. So I have healthcare is in my DNA and blood. I'm actually the eldest of three children, and I'm actually the only one going to medicine. So I follow my parents' footsteps. Both my brothers are in the business field, so they're not in medicine, but they found their own passions.
Thank you for sharing. Can you tell us? Well, you already did explain a little bit, but could you tell us a little bit more about where you're located and where you practice?
Yeah, so I'm in the Detroit, Michigan. So I'm in the heart of Detroit. And one thing I think in particular about Detroit, like many communities all across the nation, there is a big underserved population. I went to school for undergrad, just a backtrack, at the University of Michigan in Ann Arbor, Michigan, and then I went to medical school at Wayne State School of Medicine. So that's located in the heart of Detroit. That's actually one of the first universities that was centralized in there. And I am part of a hospital system. There's four major hospitals in Detroit: the Henry Ford Health System, Detroit Medical Center, St. John's, and then there's also Sinai Grace. In the program that I'm in the Detroit Medical Center. So we serve people from all backgrounds, all ethnicities, regardless of age. So like African American, Latinos, Hispanic, Indian Americans, Hindu, um, Arab Americans. We have a big metropolis of people in the surrounding metro area that we serve, and that's what makes Detroit unique. But it also provides its challenges because a lot of these people sometimes don't have access to healthcare, and that's what that we really strive ourselves on is that ability to provide quality healthcare for all populations.
Mhm. So what led you to pursue medicine? Is it something that you always knew, or was it like a specific moment that led you to make that decision?
So it's very interesting. So my mother was when she gave birth to me, I actually was or she was actually in her fourth year of medical school. So I always say I've graduated medical school twice. I walked the stage at the young age of like 6 months, and I recently walked the stage just last year. So I feel like I graduated twice. I say. However, though, I always kind of grew up in the hospital. My mother went on her rounds, the newborn rounds, and I always was surrounded by nurses in their nursing, that little caudicle, and kind of was nurtured in the field of medicine. I think my very first exposure that drew me to the field was a STEM program that was hosted by my medical school. Um, and this program exposed kids between the ages 6 to 12 to the field of medicine. So I was able to hold a human brain. We were able to dissect a cow eye or put a screw in a patient's bone that was fractured, a mock bone, but it really exposed myself to the field. And I remember telling myself vividly, like, the cow eye was disgusting. I don't know. It didn't appeal to me dissecting it. But here I am today in the surgical field, uh, dissecting and opening up people's abdomens or making surgical incisions to heal people. So that exposure, I think, early on was one of my first glimpses into the field of medicine. But I think it continued to build on. And one thing that really, I think, another pivot point in my life was when I saw a kid. He was 16 and he had collapsed after hitting a game-winning shot in basketball. And I remember telling my mom, like, "Mom, this doesn't seem right. Like, there's something I need to do." And I, through her, in a partnership with the Beaumont Dearborn or Oakwood facility in Dearborn, Michigan, I was able to set up a health screening drive that included an EKG. And I was like, if I can able to detect any changes that could potentially prevent someone from having a cardiac arrest at such a young age, I was able to do that. And we screened, I think, over 300 kids that came by, free health screening. So that was another pivoting point in my life where I thought medicine was my true calling and what led me to the field. And then day after day, I think I continued to build, and the love for sciences drew me to where I'm at today.
Definitely. Thank you for sharing. Do you mind telling us a little bit about your experience as a Muslim Arab healthcare provider?
So, fortunate for myself, I think I look white, so I do blend in with the average folk, and I think I haven't received too much backlash. But when they do hear my accent, they hear my name, they definitely will pinpoint kind of those biases or stereotypes can still arise. Muhammad, or when you see my accent, and it can pivot and cause people to have that stigma. Fortunate enough, I haven't experienced it, but I've seen other types of stereotypes, especially towards women, where certain physicians will make derogatory comments that are completely unnecessary. And it's being able to stand up, and fortunate enough that one vision that I experienced that had that situation, there was another female, actually hijab female, that stood up for her, and we were able to break that barrier and break that physical bond, that physician student bond, and not allow that individual to work with students any further. um, and I think these moments, these pivotal moments where people step up and take initiative and try to find ways to address the root of the problem, these are very big pivotal moments, especially towards Muslim Americans, but also just any gender, female, or race, ethnicity. These are really important moments. So this one I think was particular to me. It didn't apply to the Muslim stereotype, but to the female gender.
Hmm. So, what is your opinion on the healthcare in the United States? What do you think are its strengths and weaknesses?
So I think as we've seen through this coronavirus pandemic and how it insurance can really dictate care and access to healthcare,
Hmm.
it's really put emphasis on how the healthcare disparities really impacts a population more than others. And that's something we've known beforehand, but this coronavirus pandemic has completely blew it out of the waters.
Hmm.
You can see, for example, in the coronavirus pandemic, a lot of individuals, like African Americans or those who have more comorbidities, they put themselves at greater risk for more severe complications from COVID.
Hmm.
Um, and we're at a point now. I think I was talking to a friend of mine how the healthcare system potentially may shift to a kind of a two-tier model, where we may have um, the more complex patients potentially managed in the hospital, and the more simple daily routine managed more on an outpatient basis. And this kind of may kind of divulge care in uh, two separate ways.
Hmm.
But we also are seeing that insurances are really, really controlling how you prescribe and what you prescribe. So, for example, a patient that has like high blood pressure, the right medication may be lisinopril. However, their insurance may not cover it, and we have to give them metoprolol, even though we know this medication is the better tool. Because of insurance, they're not able to afford it. It may be a few $100s, for example.
Hmm.
This may not be the case, just numbers, but I'm just giving an example.
Yeah.
So this is how I think our insurance plays a role in this kind of two-tier system. May be an experience that um, may come as a result of that. Another thing that we also, I've been talking to friends of mine, is something called the concierge model, or the direct primary care model. These are where physicians um, break the middleman, and they are providing better direct care to the individual. So they provide cheaper alternatives, and kind of removing the insurance from the picture. I know a few individuals that are trying to start healthcare startups in that discipline to really bring health back in healthcare.
Hmm.
So these are some challenges that the American health system is facing today.
Yeah. And you already like mentioned the pandemic, but going off of that, how has the pandemic affected you personally and professionally?
So I think personally, I was a victim of the coronavirus. My family had it.
Hmm.
So fortunate enough for me, in terms of my experience with the coronavirus, I had experienced the flu 2 weeks prior to that, and I was very similar set of symptoms, where I had kind of a blimp of like myalgias, muscle aches, feeling achy, felt febrile for a day, and then I was able to overcome it. However, my brothers, one of them had residual effects from it. He's still having difficulties with taste fully comprehending taste and being able to taste all objects. And that's something that, although minute, it can impact your quality of life. I mean,
Mm-hmm.
your taste is really linked to your sense of smell. And oh, sorry, he lost his taste and smell, and taste and smell are really interlinked. So it
Mm-hmm.
really can impact your ability to kind of really enjoy foods. And especially as Arabs, we love our food.
Yeah.
Food is a big staple to our lives. We love big, robust flavors and cooking. So that aspect of it can definitely be an impact on life. And my father, um, he's a diabetic and high blood pressure, so it impacted him a little bit more than us, especially given his comorbidities. So he had more residual cough and more severe set of symptoms that we did, but fortunately he was able to recover. Um, so I know some people have had it worse. We're fortunate enough we recovered from it and we didn't need to be hospitalized, but it personally did affect our family. And then I think your second question, part of the question was how has it changed my viewpoint, I believe.
How's it affected you professionally?
So professionally, I think I one thing that we in terms of that is just the mask wearing, where I'm more. I think because I've seen more of it, there is a higher sense of like hyper awareness to what COVID can do. A lot of individuals will say they we have was people are being intubated on the ventilator, or we're placing chest tubes and that all. And although the news portrays it, you can see it visually, but when you're there one on one doing that on an individual or being called to do that,
Mm-hmm.
it's a different scenario because you're seeing it day in day out. And fortunate enough, it hasn't impacted my psyche too much, but it has had days where it's been mentally draining because these individuals come in somewhat healthy. They come in for a simple chief complaint of a cough, and all of a sudden their life is just completely upside down. They're on a ventilator. You never know if they're gonna get off it or go home, and it's just surreal to have this virus put so many people that maybe had a few underlying conditions, and all of a sudden their life is completely flipped.
Mm-hmm. And you already touched on this a little bit in your on the previous question, but how do you think the pandemic has affected access to healthcare?
So yeah, I think I discussed a little bit about it, but the access to healthcare, fortunately, we do have Medicare, Medicaid, and that's increased access.
Mm-hmm.
And the people nowadays, because of the coronavirus, they're scared to come into the hospital.
Mm-hmm.
So a lot of individuals will hold off routine complaints that, or even going to their doctor's office, they're scared to go there as well. So um, people may hold off their complaint, maybe somewhat benign or very miniature in nature, but if they continue to hold it off, they may have a delayed diagnosis in a certain condition. A lot of individuals are putting off like surgical procedures for removal of cancers or routine diagnostic exams like mammograms or colonoscopies that would routinely find potential masses in the breast or in the colon. And now because they're not coming in for them routinely, it can delay their quality of care, and they may find the diagnosis not at stage one but stage two, three, or four,
Mm-hmm.
or more severity of the disease than it should be. So I
Mm-hmm.
think that's going to be the biggest concern. We're going to see how it impacts a few years out. How is the delayed access, is it going to increase the incidence of certain cancers because we're not screening as much?
Mm-hmm. And you again touched on like the health disparities in our society currently. Can you tell us a little bit about your thoughts about COVID disproportionately impacting racial and ethnic minorities?
I think we've always been somewhat aware of it, but
Mm-hmm.
now it's because of the Me Too movement, the Black Lives Matter movement. There's being more press to these issues and healthcare disparities, so that we can have dialogue on these issues. And when dialogue comes, there's going to be confrontation. There's going to be challenges, but these uncomfortable conversations are the important ones necessary for change. So, as much as we want to avoid it, I think having these moments and having the real raw data in front of us um, is just going to make it hyper aware, which will then drive change. And I think that's I think one of the potential good things of the coronavirus is it's put it on the broad scale map. Like, this is a pressing issue, and now people are talking about it more and
Mm-hmm.
more.
So you also recently had gotten the COVID vaccine. So could you tell us a little bit about your experience in getting the vaccine?
Yeah. So So just gonna break down. There's two vaccines that are prominent. There's a third one, I think AstraZeneca. So there's the Moderna, there's the Pfizer, and there's the AstraZeneca. I got the Pfizer vaccine that was offered through my hospital system. I know others have gotten Moderna or AstraZeneca. Just as a breakdown for it, the Moderna and the Pfizer are both mRNA variants, so there's no live strain. The AstraZeneca has a, I think, I believe, a kill live strain or
Mhm.
killed strain of the virus. So they're two different types of vaccines. I got the Pfizer, and my first dose, I just had a little muscle ache surrounding at my injection site, and very minimal. I think about 12 hours in, I had some aches, but otherwise, I did take a Tylenol overnight and never had any symptoms afterwards. And now I was very clear. Then a couple weeks later, when I got the second dose vaccine, I had heard from others individuals just from previous who had got it before me. Those who had the coronavirus um, had a stronger reaction to either dose one or dose two.
Mhm.
I had it to dose two. About, I would say, I got my vaccine about 8 9 in the morning, and it was about 3 in the morning where I woke up with chills, body aches. I was shivering, felt
Mhm.
febrile, I felt feverish. Like I really felt like I was going through the ringer. And I remember going downstairs and grabbing a Tylenol. And fortunate enough, when I woke up the next morning, sleeping it through in the Tylenol, my symptoms had resolved.
Mhm.
So I think a consensus that just from hearing other stories, just verbal stories, is those who have had coronavirus tended to have a little bit more stronger reaction. And my theory or guess behind that, I think, is that you've had a built immune response before into it, and the introduction of this variant just kind of made it hyper aware, and your body's now mounting another immune response onto that,
Mhm.
which is just showing that your body's building that immunity, building that health memory, saying so when it comes and be exposed to it, it can potentially fight it off and reduce the risk of getting it or getting more severity of the coronavirus.
Mhm. And I just wanted to end by asking, what are your thoughts on the awareness that we're receiving about the virus as well as the vaccine? Do you feel like it's adequate, or is there anything that you'd like to emphasize about the virus or the vaccine?
So I think the media coverage has made it really hyper aware, and it's I think been a politicized issue
Mhm.
on like Democrats versus Republicans. But I think at the end of the day, this is a human health crisis. Um, as there, it's gonna be an issue of opening up the economy and what's safe for people, but also it's kind of weighing the risk and benefits. Like anything in life, you're gonna have to weigh the risk and benefits. And I think
Mhm.
at the end of the day, we gotta think of what's best for us. And um, our human health is their biggest investment. So I'm in the healthcare field. I'm always an advocate for the vaccine. I know there's be individuals that are wary of it. Is it going to inject something into us that's a hyperchip or whatever? This vaccine that we're taking is a new form of technology, but it's been around for about 20 years now. The Moderna and Pfizer is a mRNA variant of it, so there's no injecting DNA. There's not altering the DNA. It's just injecting some kind of material that encodes for a protein that codes for the spike on top of the coronavirus. So that's what it's attacking, and its ability to form memory cells to that, so that if you were to be exposed to it a second turn around after getting the vaccine, your body can mount a response to that spike protein and say, "Hey, I've seen it before. Let's fight it off. How am I going to fight it off?" And it limits the severity of a much more severe disease. We don't know the definitive if it's able to just fight off and minimize the virus in general, but there's going to be more studies out as we go on throughout this year to figure out how applicable is it to preventing disease and limiting disease in general. But at the same point, we can't let our guard down and not wear masks. I know there's individuals that have done that, or states where they're allowing the mask mandate to kind of be a little more free. I think it's important that individuals continue to social distance. They wear masks. I know individuals are be more inclined to have groups interactions. I am as well. I'm just trying to minimize the amount of that, and a lot of individuals that I'm surrounded by, fortunate enough, have had the vaccine. Um, so we've built some of the immunity, but we will see the long-term effects of this vaccine and what it will do for our fight against the coronavirus.
Mhm. So that's all we have for today. Thank you again, Dr. Mohamed, for coming. It's been really great talking to you and hearing your thoughts. I'm sure everyone watching has gained some very valuable knowledge from this. And lastly, I'd like to thank all of our viewers for tuning in. Please remember to stay safe and wear your masks.